Seasonal flu has reached a 15-year high this year, overwhelming hospitals, forcing school closures, and leading to an estimated 19,000 flu-related deaths in the United States alone. The toll has even surpassed winter COVID-19 deaths for the first time since the pandemic began, signaling a severe public health crisis. While flu cases surge, other respiratory infections such as RSV, norovirus, and COVID-19 remain widespread, further straining an already burdened healthcare system. The combination of these viruses is pushing hospitals to their limits, with some resorting to makeshift triage tents as intensive care units fill beyond capacity. If this flu season continues its trajectory, the consequences could be even more devastating. Several factors have contributed to this unprecedented flu surge, making it one of the most unpredictable and dangerous seasons in recent memory. Experts suggest that colder than usual winter temperatures have driven people indoors, increasing close contact transmission. Influenza spreads easily through respiratory droplets from talking, coughing, and sneezing, and confined spaces provide the perfect conditions for the virus to thrive. Additionally, the lingering impact of pandemic-era precautions has left many individuals with weakened immunity against the flu. During the COVID-19 lockdowns, social distancing and mask use significantly reduced flu circulation, limiting natural exposure to the virus. As a result, population-wide immunity has dropped, creating what some researchers call an immunity gap. This has left both children and adults more susceptible to severe flu infections now that society has returned to normal interactions. This flu season is also unique in its unpredictability. Unlike typical flu seasons that see a single peak with one dominant strain, this year has witnessed multiple waves of infections, with both H1N1 and H3N2 circulating at the same time. The simultaneous presence of these strains has led to a prolonged and severe flu season, with no clear end in sight. While flu vaccines are updated each year to match the most common strains, the unexpected nature of this season may have resulted in a weaker vaccine match. Some preliminary reports suggest that this year's flu shots may be less effective than usual, but more data is needed to confirm the extent of this mismatch. However, even a less effective vaccine still offers protection against severe illness, hospitalization, and death. Perhaps the most alarming trend fueling this flu crisis is the decline in vaccination rates. Data from the CDC indicates that flu vaccine uptake has dropped by 7% compared to last year, with fewer than half of Americans immunized. This decline is especially concerning among children under 5, one of the most vulnerable groups where flu vaccination rates have fallen below 46%. Given that influenza can lead to severe complications such as pneumonia, organ failure, and even death in high-risk individuals, the low vaccination rate is a significant contributor to the current crisis. Without higher immunization coverage, the virus will continue to spread unchecked, prolonging the season and putting more lives at risk. The current surge serves as a stark warning that flu remains a formidable threat, even in a post-pandemic world. While COVID-19 has dominated public attention for years, influenza remains a highly dangerous virus, capable of causing tens of thousands of deaths annually. The surge also highlights the vulnerability of healthcare systems, which are struggling to manage multiple viral outbreaks simultaneously. The combination of flu, RSV, norovirus, and COVID-19 has stretched medical resources thin, leaving hospitals unable to adequately care for all patients in need. If flu cases continue to rise, the situation could become even more dire, forcing healthcare providers to ration care and make difficult treatment decisions. Despite the severity of the crisis, there are steps individuals can take to protect themselves and their communities. Practicing good hygiene, such as frequent hand washing with soap and water, can reduce the risk of infection. High-risk individuals, including young children, pregnant women, the elderly, and those with weakened immune systems, should consider wearing high-quality face masks in crowded indoor spaces and avoiding poorly ventilated areas. Maintaining a healthy lifestyle by getting enough sleep, eating a balanced diet, and staying physically active can also help support the immune system. However, the most effective way to prevent severe flu outcomes remains vaccination. Public health experts continue to recommend that everyone 6 months and older receive an annual flu shot. Although it takes about a week for the body to develop protective antibodies, it is not too late to get vaccinated, as flu season is likely to persist for at least another month. Even if the vaccine does not completely prevent infection, it significantly reduces the severity of illness, lowering the risk of hospitalization and death. The surge in flu cases should serve as a wake-up call. Complacency towards seasonal flu can have deadly consequences, as this year has already demonstrated. Without increased vaccine uptake and stronger public health measures, future flu seasons could become even more severe, particularly as climate change and evolving viral strains make predictions more difficult. As hospitals struggle to manage the crisis, it is crucial for individuals and policymakers to take immediate action. Getting vaccinated, practicing preventive measures, and supporting healthcare infrastructure are all essential steps in preventing further loss of life. If urgent action is not taken, the current crisis may only be a preview of even deadlier flu seasons to come.